My name is Stebulo. I'm the chairperson of National Epilepsy Association. I have a few things to make mention concerning the issues to do with disasters. The element of disaster is one that needs to be recognized pertaining to the life of persons with epilepsy. Persons with epilepsy has been affected by the disaster that has been happening in the country in a way that their access to medication has been limited, and not just also limited by the infrastructure element, but also the service providers has been unable to get rid of the community they serve. And adding to that also, it has we have had a shortfall of medication just because the direction or the attention has been drawn to the response programs by the government. So in that context, the government has shifted their attention, and the procurement of anti-epilepsy drugs has been hit by that element. And it has been now about 7 to 8 months that in government hospitals there have been no drugs, and that has affected lives of persons with epilepsy. And so to say, I need to communicate that lives of persons with epilepsy has been at a risk. Just this risk is coming in a form of not getting the medication, thereby having frequent seizures. And these seizures also has risked lives of persons with epilepsy. Some of them have been dying just because of lack of medication, just because the medication supports a person with epilepsy to have a limited seizure. So if you're having a frequent seizures, then you're at risk of getting or losing your life. We have scenarios as such in some of the districts, like in Sanje. We lost some lives just because of lack of medication. If you're taking medication, the level of seizures is controlled, is limited. So thereby, as we describe them as anti-epileptic drugs. So these drugs removes the threat or the problem that is associated with participation and all that. So if you are taking the medication properly, you stand a chance of living a normal life, or living a life that is independent, a life that is having no problems or having no challenges at all. But aside of anti-epilepsy drugs, then somebody's capacity, like mental capacity, is also affected. Even also, not just the mental capacity, but also the capacity to function, the functionality of the person is also affected. Thereby, someone can lose job, someone can use even marriage, someone can lose a lot of things. Even not, we are also can be that somebody can also be affected in a matter that he or she can't attend school, or she can't have access to education, just because that somebody is lacking that capacity which I'm referring to. So that element has been one of those that we need to report, and also we need to continue engaging the partners. Also we need to advocate for, just because up to now we don't have medication in our hospitals. So that's what I can say of now. Thank you.